Laboratory Supplies, or SLS, are the UK's largest independent supplier of laboratory products and were chosen as the vaccine storage partner for the Department of Health and NHS England to supply and distribute ultra-low temperature freezers across the country in time for the vaccine to be received. We started by asking Joshua Chapman of SLS, how did the NHS know to contact SLS about the supply of these vaccine freezers?
It is an open market. We are a framework supplier. It's not just someone who's been picked up out of nowhere. We are a contracted framework supplier of the NHS, which is how obviously we engage in these conversations.
And just how many of the units are you looking to supply under this contract, and in what timescales, making sure they're in place in time to receive the vaccination safely?
The contract for the NHS supply chain for the vaccine storage required 380 of the 101 litre underbench units, which you've seen today, and for the mass storage requirements a further 60 of the 570 litre units. So far we've delivered 56 of the smaller units, and all 60 of the large units have gone out, and they're all now ready to receive the vaccine. Liaising with the Department of Health, we had a sort of moving deadline, but we always wanted to deliver this by the end of December, which gave us a 4-week period to bring all this together to make sure that we were successful in delivery of these items. Working with key contacts at the Department of Health, the NHS supply chain, and obviously our colleagues at Eppendorf as the manufacturer, we're obviously happy to see that we've managed to deliver on that, on schedule and on time.
SLS have taken this project on internally, so just how have SLS delivered this extensive programme without the help of the Army like some other countries?
We've had to split the country into two. We've had a northern and southern area, and we've engaged with courier services for those particular areas. We've also engaged with multiple off-site storage locations, so we didn't have all our proverbial eggs in one warehousing basket, so to speak. And that allowed us to obviously be more reactive to those locations and ensure we can get the deliveries out and do that a lot quicker than we would have done if they were all in one centralised location. And obviously that mitigates any security concerns. If anything happened to a particular warehousing unit, there's still plenty of units elsewhere. So we didn't want to be jeopardising any supply of the actual units for the vaccine.
With so much riding on the successful delivery of the units, what did SLS do to make sure everything went smoothly?
It was a 3-phase delivery schedule, and we worked with our colleagues at Eppendorf to deliver just that. We obviously, it's important to note these units aren't the same as just your standard freezers. We've had to engage with site surveys at every single location because they're very large and they're incredibly heavy as units. So engaging with the NHS sites to do that, it also allowed us to implement and recommend safety, storage and ULT protocols. It allowed us to simulate vaccine packed scenarios, and also with engineers we could temperature map the units and validate each unit in situ. As you can imagine, with a logistical operation of this size, there's always going to be unforeseen changes to the plan, but hopefully through the project management team we've actually mitigated those and dealt with them as and when they come. We've had incidents where we've been looking to deliver a unit and the location would change right there and then we'd have to move it elsewhere. We've had delivery dates change, and ultimately we didn't know when the vaccine was going to be available or when it was going to be ready, so we've had to obviously mobilise and make sure we hit those deadlines, and we're happy to say we've achieved that.
How well were SLS equipped to deal with a project like this with so many moving parts in such a short timescale?
Quite simply, that's what we do as a business. We're a very flexible organisation. We mould our operations to individual customers' requirements, and the NHS isn't any different to any other customer really. The scientific nature, the scientific community that we support, it's always fast-paced, it's always fast-tracked, and it's always a fluid arrangement, because no matter what the research, we're having to get product out to make sure that research can be continued. You can have 3 years worth of research that can be put at jeopardy if you don't get the supply of products out in time. So the NHS requirements, whilst granted they're obviously scaled up, it's still very, very similar to the usual requirements that we deal with on a day-to-day basis.
Were there any concerns about security throughout the project, especially as other suppliers supporting rollouts across the UK were subjected to cyber attacks?
What the pandemic has brought is an increased spotlight on all activity around anything to do with the research all the way through to the vaccination process. So we didn't want to do anything that would put anything for the supply of these units at risk. So we've made sure we've kept a very low profile throughout this whole entire process until the information has been publicly available. We've spread the risk by having multiple off-site storage locations, multiple different couriers, and that's just allowed us to mitigate any potential security concerns that we might have.
Larger storage units have all been delivered, so where does the project move on to now?
Well, the rollout now continues through to some of your smaller establishments. Hospitals are geared up to receive equipment of this size, but your local GP might not be. So, you know, your local GPs, your local pharmacies, they're the sort of establishments that this delivery schedule now focuses on as the next phase of this project.
It sounds like you would consider the source and supply of these units a resounding success. Is there anything that can be learnt from this project?
I think what this project has demonstrated is, in the UK we have a world-leading scientific community. It is really something that we should all be proud of, and we're the UK's largest independent supplier of scientific products, and we're working with a world-leading brand like Eppendorf to deliver these units across the country for vaccine storage, and they're manufactured here in the UK. I think what's important to know is just what can be achieved despite, you know, insurmountable hurdles with a logistical operation. If the scientific community is trusted to deliver on these projects, and we've done that, we've delivered on time. We had a plan, we've executed it, we've communicated and advised throughout the whole entire process despite changing circumstances, and we've delivered on time, on schedule, and more importantly on budget.
I guess you would hopefully like to see scientific suppliers used more for these type of projects moving forward.
I certainly hope so. I think it's been a frustration for the scientific community to see that there hasn't always been this reliance on us to support the community that we do day in, day out. A pandemic is no different from any other time for us as a business. You know, these are the same customers that we've dealt with before, and we should be trusted to be able to supply them. As we've demonstrated, this is what happens, and this is the kind of service we can deliver when we are trusted on projects of this size and this nature.